everybody, welcome to a new version of the Vertical Insights. Today we're going to talk about the challenging topic of targeting in the area of rare disease. And we will talk about how you can identify, first of all, of course, the relevant HCPs using AI. And then we will talk about how you can identify those HCPs who might be relevant but are not in this educated level for this special rare disease. And then we will see how you can leverage the data to extract networks in your specific indication area. Why do we talk about rare disease? Rare disease is one of the biggest topics right now in the pharmaceutical sector, not from a commercial perspective, but from a patient perspective, because it is a really great big challenge for patients to get the right treatment. And for every stakeholder, it is a big challenge to have the working drug from a pharmaceutical perspective, but also having the right treatment and having the best knowledge from an HCP perspective and having the best patient pathways in a very complex sector in the healthcare system is for every stakeholder, it's quite challenging. But a good HCP targeting can help as a puzzle piece to have a better process and have a better patient treatment. So let's get started. How can it look like? So first of all, I want to present you how we define in one indication targeting, how we do we identify a relevant HCP. So I chose for today the rare disease pulmonary arterial hypertension. And there we identify based on the content. So we defined content which is relevant for the indication. We identified a physician who is, the name is Professor Dr. Eckhard Grüning in Germany. And I will show you some sources our system identified. So here are some sources, 1, 2, 3, 4, and 5. And 6, and as you see, he is, for example, he is mentioned, Eckhard Grüning, and he is just recently he published an abstract in a magazine, Internal Medicine, and is talking about the pulmonary arterial hypertension, and the abbreviation is PAH, and therefore you can see he is really engaging with the topic. He is into the topic, he knows much about it, and he has a scientific footprint, and so he is an expert in this topic. So he's relevant for you as a pharmaceutical company to engage with him, to talk to him, and to know his views on the indication and to talk about your products. And this is the first step. This is the step how you can identify the HCPs. So the good thing is that you do not have to define the sources. So you just need to define the content where you want to look for, and then you will find HCPs with AI, because AI is able to first see the sources and then extract the content and know that Dr. Eckhard Grüning is relevant, and you will see the several sources in a result. The next step is, so this is the first step. So we identify based on the content relevant HCPs when they are talking about the indications. But therefore, that's rare disease is you need to define more content, because there are several HCPs who are talking about other diseases or like related topics to the rare disease, but not specific. And most of the time it is because it's too rare, so they are talking not exactly about it. And second, they don't know about the rare disease. So you can go the path of misdiagnosed. For example, give you an example. The more common disease is the pulmonary hypertension. So not the pulmonary arterial hypertension, but the pulmonary hypertension. And as you see here, you see that more than 2,000 HCPs are talking. Well, this is our demo environment of the vertical surgeon. I made an analyst, and you see that more than 2,000 HCPs talk about pulmonary hypertension. Here is an example of a physician's office where they talk about this indication. So those physicians are really, really interesting for you to engage and to make an awareness campaign. And say, hey, do you know about this indication? Do you have patients? What about the like the sub indication or the rare indication of the topic of pulmonary arterial hypertension? So you see, you can content-based, you can really be very precise to identify the very specific and then the topic around this area. And then you are in the next step, you are in the identifying of awareness candidates, because those are like similar personas. You have the possibility to, of course, of the misdiagnosed people who maybe more diagnose the pulmonary hypertension, but to be honest, it is more the arterial hypertension. This might be, but also those people, and there are, as shown, there are several HCPs talking about the pulmonary hypertension. You can use them as your awareness candidates and say, hey, think about this diagnosed way, think about this clinical picture to really identify the patients, because those physicians are treating patients or are interacting with indications who are related to the rare disease, but maybe they are not good enough educated, they don't know enough about it, and so you could talk to them, make an awareness campaign, and see that they get relevant. So you, first of all, you can define the very precise content, then you go like in a broader way and make a more brighter, a broader segment and say, okay, those are those people who maybe make the misdiagnose, or are the people I want to make an awareness campaign and say, hey, you know, you talk about pulmonary hypertension. This is good. Did you know that there is the pulmonary arterial hypertension? And when you have a patient which has this clinical picture, then try this and that diagnostic way, and you will see how that they are patients that they have the rare disease. The next step is, and this is very important, is the network analysis for the indication. And this is what we do in 3 steps. So we do the formal network, the informal network, and the referral network, and all based on the open data. Why is this important? It is important because in this area, in these networks, healthcare systems always work regional. And this is also in the topic area of rare disease. You need to know who is connected to each other. So when you know that somebody is important and he works with other HCPs together, you can engage through the important HCP with others for awareness topics, or for, of course, to engage with high potential prescribers. And this is an example for the formal network. So you see, and this is an example where somebody is talking about the pulmonary arterial hypertension, and then there is an answer and reply to this abstract of other physicians, and there you see a formal network. We call it formal network because it's happening in the area of abstracts and publication, which is like official, and there we can extract based on AI the connections and see which physician is working in which abstract together. The next step in a network analysis is the informal network, because physicians are providing, for example, CVs. and in those CVs there are many connections. And as you see here, those physicians are relevant in the topic of pulmonary diseases, and everybody of them worked in this in the same clinic with the same protégé, with whose name is Professor Dr. Heusinger. And this connection is only extractable with AI. So you will see this analyst, and you will see this connection only using AI. And this connection leads to a completely new network and a completely new view to your physicians, because those physicians are completely spread over in this case over Germany, but they have one connection, that they worked in the Asklepios Klinik Gauting in the same time slot and had the same protégé, the same doctor, Professor Dr. Heusinger, and they are all connected to the disease and all connected to the pulmonary topic. And this is a new way to view the HCP network. Same procedure, but different information. So this one is those physicians are also talking about the PAH and have the same studied at the same time slot at the same university in Munich. And when you engage with one, you have a topic to talk about the other and know, all right, you are connected. Could you introduce me, or would you like to join me in a symposia? These are informations you really can leverage with AI. Other network analysis is the referral network, because in rare disease, it's very important to have good connections, to have good patient pathways. And those physicians who know about those pathways and have a regional network already established, they communicate about it. And this practice, for example, communicates a cooperation partner for the cardiologic cooperation partner, because in this indication of PAH is the cardiologic perspective very important. So they work together, and so they can introduce, they can present you, they can have together a talk about the indication, about rare disease. And also you see here that the regional networks are communicated. For example, the regional health network, Starnberg-Wolfratshausen Health Network, where also are GPs involved. And this is very important, because the pathway of the patient is he goes to the GP, has a problem, and when the GP is aware, because of the health network and because of your impact in the health network, then he will get a very good treatment. Here, another example of the health networks. So in this area, what we just looked at, this is the area of South Germany. The Starnberg-Wolfratshausen Health Network is communicated by 19 practices, by 19 HCPs. So there is a network based on the content and based on AI we can extract, and you will see every connection, and you can engage with those who are really relevant and connect through those ambassadors regionally, and see how you can build up those pathways, how you can engage with the GPs who is seeing the patient, who is referring to a specialist, and those specialists who are referring to another specialist, and you know this network and can be part of the patient journey and to identify the patient, and then to talk with the HCP and say, hey, you know, there is a new drug, and then you have a really good prescribing network. And this is how you proceed with AI and with open data, the extraction, and how you can get HCP insights. So summarizing, first of all, you define the very precise content, who's relevant for me, what should an HCP talk about, and then be very precise for your indication. You will identify in any source in the open data space many HCPs who are talking already about your indication. Second, you define what could be a related topic or a misdiagnose for awareness campaign, for educating the physicians that they should look left and right when they are saying, well, it is indication A, but it could be the rare disease. They need to be educated, they need to be aware. This you can also define through the content. And then the third step is that you have a regional network analysis where you can extract all the connections, whether it is formal or informal or referral network based on the content. This is possible with AI. This is possible with the vertical search health, and we are happy to help you in a rare disease project to identify the relevant HCPs and relevant connections for your indications.